pellets, 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 like
Yeah.
literally like, animals going through a warehouse. That's what a lot of these hormone clinics are like.
Hello, everyone. Thank you so much for joining us for day 4 of this very orange. Orange is the new hormone balancing challenge week. Thanks for joining us. I'm Anna Manuel alongside Dr. Maggie Yu. Jamie, I saw asked a question saying, why don't I just go to a hormone specialist then? Is that the answer?
The answer is I wish that was the case. I mean, what do we call a hormone specialist? 99% of these hormone specialists that are out there being called hormone specialists have gone through maybe at most a 3 to 4 day conference. And I've been to multiple of these to see how they train for this. And really no clinical practice whatsoever, no one to mentor with, no experience. I mean, I've been in practice 27 years, 16 of which as a hormone specialist. When I watch how they train in these 3 to 4 day conferences, they're getting literally 1% of what I've learned in the last 16 years. And then they quote unquote, I did this course and I'm going to be a hormone specialist. That's a problem. Number 2, the financial model of how these hormone specialists work is they're there to sell most of the time hormone pellets, which is hormone replacement therapy, which I'm not against. Some people need it. Okay. But this is high dose, really long-term hormone pellets that they become like pellet mills that make them a lot of money because they can have 6 people line up, 10 people line up. They don't even have to be in the room. They could have an assistant do all this. And so it's like a money-making machine for pellets, 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 like literally like, animals going through a warehouse to be, here's the antibiotic, here's the pellets. That's what a lot of these hormone clinics are like, is a pellet clinic. But unfortunately, when you replace hormones in high doses like they do in pellets, the worst imbalanced patients and clients I've ever dealt with were people who are on these very pellets, right? So therefore, it is very challenging because I find very few people out there that are ethically, scientifically, and accurately truly helping people with hormone balancing using many tools like diet, like movement, like education, like supplementation, and sometimes hormones, but very low dose for balancing, not to nuke you. That's what true hormone balancing and hormone mastery is. Unfortunately, if you don't have doctors that are doing that, patients and clients are left in the dark about this. And this is why for me, orange is the new power color, because for me, like, it really represents how do you then get really powerful about this? You have to be educated smarter than they are, because it's really easy to be smarter than they are on this, because the actual depth, lack of knowledge out there is huge. And if this is ringing true to any of you, am I making this up, or has this been resonating with you with your own experience dealing with hormone specialists?
Well, it rings true even for me. I experienced it as well. My functional medicine doctor, who is well versed in many other things, admitted to me readily, hey, I'm not a hormone expert. We need to find you someone who is. And the only person that she could think to recommend me to was somebody that you mentioned that was going to offer pellets. And I said, this doesn't feel right to me. And that's when I found who? Dr. Maggie. That's how I came across you in the first place, because you are the hormone expert as it relates to truly balancing your hormones naturally and fixing chronic disease as a result. So, I mean, I see Laura asking on here, what is a comprehensive approach then? What can be done, and how do you get a comprehensive approach to all this?
So here's the thing is that I have worked many years in my own functional medicine clinic before we started these online programs, and I was, I was, the first MD bioidentical hormone expert, really in Portland. This is, we're talking Oprah, Suzanne Summers, that when this was like almost a taboo topic. And because of my own hormonal struggles, I decided to learn about this. And I started working and learning with compounding pharmacists, going to conferences and learning almost down low how to do this. So a couple things for me I realized was that hormone replacement therapy doesn't equal hormone balance or a health transformation. So in that sense, for me, this is why, I've created my Hormone MasterClass, because when I think about it, data is king, right? You got to have data. Data is king. We started talking about hormone testing, right? But the problem is if you don't have providers or patients trained on what those patterns actually are, then they're going to be missed and people are going to be erroneously told that those are normal, even if they were lucky enough to get the right testing done. So for me, number one, proper testing is really important, right? And I love doing saliva hormone testing. Number two, you yourself have to be educated on what are the patterns. So you know what you're talking about. I don't know how many times when I talk about some of the patterns like estrogen dominance, hidden PCOS, low everything, these kinds of patterns that when someone from our programs will go to their doctor, some are very, very candid and say, I've never had any training on this. You do know more than I do. Some will be outrightly ambivalent and dismissive and be like, that's all bullshit. Well, sorry, lady. This ain't bullshit. This is based on data. Okay. Based on data and an understanding the pattern. That's scientific. So another question that comes about would be people talk about, what if I'm already on hormone therapy? Because we're going a lot about people taking hormones. And I just saw a question where someone just asked, well, what if I'm already taking hormones? And you already know, if you're already taking hormones and you're watching this, it didn't solve your health problems. Okay. Right. Okay. So some of the worst, most imbalanced people are people taking hormones, which is why for me, if you're taking hormones, it's even more critical for you to actually get your hormones retested. And even while you're taking the hormones, get it retested. You don't have to be off the hormones to test your hormones. And in that way, we can look at those and we can be like, what are these hormones you're taking doing to you? So you're like, oh, no wonder I got such bad migraines with it, or no wonder I gained 10 pounds with it. So it's not like, so you can then understand the new data even when you're on hormones, and that can help you explain that you're not crazy, that there was a medical reason why it didn't work or it made certain thing worse. And it can then lead you even closer to the solutions, which is what I love to do, is to look at each person's case, each person's individualized data, and customize solutions for people that are really needed. Look, I'm not a one trick pony and neither are you. Unfortunately, the doctors you're going to are. So that's really key, is that even if you're taking hormones, especially if you're taking hormones, you need hormone balance even more. And so I would say about 20-30% of people who are in my hormone masterclass are on hormones and looking to see, why isn't this working, or what can I do about it, and what adjustments can be made. And that's why for me, Anne, the ability to retest over time, over a year in my hormone masterclass, and be able to present, oh, this is the intervention I did, here's what happened, and here's a retest. That's additional data from your body I freaking love. And then I could be all mad sciences about it. So there's testing, there's retesting, and master level troubleshooting as you go through the entire year of my hormone masterclass with me and with others. So to me, that's really critical to a comprehensive approach to hormone balance, is proper testing, your education, the ability to actually go longitudinally over time to retest, to add that to your data set, to adjust and pivot, adjust and pivot. And that's how people really achieve hormone balance.
And all of that is encompassed in my Hormone Masterclass that you offer.
If you're interested in working with me on my Hormone Masterclass, there's a link here to check out my Hormone Masterclass and to enroll. I would go ahead and we'll click a link for here to book a chat with our team. Or the other option is there's also an opportunity to start a live chat with a member of our team as well. And they can point you to resources to learn more about our other programs and what solutions there are to other health symptoms.